If you look around, you'll see the world can be pretty smart. Okay, very smart. At Capella University, we think education should be smart too. That's why we're reshaping online learning with our FlexPath format. You can set your own deadlines, take classes at your own pace, even leverage your previous experience to move faster. So when it comes to earning your bachelor's degree, you know what kind of choice to make. A smart one. Visit capella.edu to learn more. Capella University. Don't just learn smarter.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Ravello, and I am here on the very first podcast of 2021 with Dr. Jay Calvert.
Good to see you, Millicent.
Always a pleasure.
Happy to be here to start off the new year with a new approach to the podcast.
Yes, we have some interesting ideas up our sleeves, which we are very excited to bring.
Yeah, I think today we'll just talk about the new year and the new you, but I think we're going to do a whole new approach to this podcast and really start pushing it towards a video podcast.
Right, that would be the idea, something that we can really put out on various platforms, really as an education tool is sort of how we're looking at it.
Yeah, I did my sort of first Instagram post today thinking about what I wanted to accomplish this year, and education is kind of what I think needs to really be forwarded through our podcast, through our patient education materials, through any of our social media. I really want education about plastic surgery, what it is, how to approach it, and how to get great results. That's the focus.
And I think that it is especially critical right now because there is a wealth of information out there, and much of it is disinformation, especially when it comes to plastic surgery, because the rumors and the fallacies and just the plain out lies and marketing that happens in plastic surgery is terrifying. And we can certainly link other podcasts we've done, on like board certification in plastic surgery and various things like that. But yes, the idea of these podcasts is to inform other plastic surgeons as well as mainly the listeners,
of course,
the prospective patients on legitimate plastic surgery.
It's hard to discern what is the true information, if there is such a thing. My patient was just here, and she had a deep plane facelift, and she was at 2-3 weeks after surgery marveling at how great she looks. And her kids said it, and her, one of the folks around town said it. And she kind of said, my friends who've had facelifts don't look like this ever. And I said, that's because they didn't have this type of facelift. And that's a problem when information just gets lumped into baskets. Just because Botox gets sold in units doesn't mean that Botox is delivered the same way.
No, not at all. And we have another podcast we can link to about that as well. Yeah, no, there is a lot to know about plastic surgery. And certainly, you could go down a deep rabbit hole on any given topic or subject. But hopefully, some of these podcasts will just be helpful to get the basics and the foundation of any given procedure. And then you can start to really ask, the informed questions based on what you hear.
Well, since it is a new year and we think you should work on a new you, what would be your approach? If you were just sitting there thinking to yourself, this year I want to be better looking on December 31st than I am today on January 1st or 2nd, whatever we are now. If you want to really look over the year, how would you as a consumer of plastic surgery services, products, and surgery, how would you approach the year?
So that's an excellent question. New year, new you. Blah. I hate that expression, but it's very fitting for what we're doing right now. And I think that we have to look at this particular new year, new you moment of time through the lens of COVID-19, because we are definitely very much still dealing with that. And so that puts a little bit of an extra spin on what you can and can't do. Not can't do, but what you can do, I guess, is a better way of saying it. So we mentioned this briefly